Good evening, good evening, good evening. Welcome to Below the Skirt with Tamara. I am Tamara Green, pelvic rehab therapist, helping women like you live your best life below the skirt. How are you ladies doing? I look excited. I get ecstatic when I come to see you every Tuesday, same time, same place here in the pelvic floor group. So we have our guest, as we always do, Virginia. She is our guest. She is your guest because she's not really a guest because she's always home with you. Let me check my lighting a little bit. I'm doing some recording, y'all, to get some courses out there for people to be able to do things in the comfort of their home. So I'm kind of playing with some stuff. But Virginia, here she is. I should do a quiz. I'll do a quiz, and I'm going to send you a free gift. Can you name the 3 organs that sit within the pelvic floor? And I'll let you cheat. You can go back and look at some previous lives. But the first person that can name the three organs that sit within the pelvic floor, I will send you a free gift, okay? And just put it in the information there. But the question that I have for today, the topic is, what is an episiotomy? Now, an episiotomy. So episiotomy is where there has been a surgical incision placed in the perineal area. You may ask, what is the perineal area? Now, we have the lips, the labia majora, right? And then we have the anal canal. The perineal region is that area between the vaginal opening, lower part of the vulva region, and the anal canal. This little bit of skin area. It's very, Jamila got it. Jamila, I will message you to the side. I will send you a free gift. The 3 organs within the pelvic floor is the bowel, bladder, and uterus. But in reference to how they do sit from front to back, it is the bladder, it's the uterus, and it's the bowel. So good job, Jamila. I'll message you and I'll get you a gift out there. Now, the perineal area is here. So what happens during childbirth if some women tear during that component of time, or some women, their doctor will go in and make an incision at that component, at that area, so then you won't tear. Ideally, it's better to have a clean cut versus, think about it, if something rips. Let me give you this tape for an example. If I nicely had some scissors, which I do not have, and you can tell I'm painting, but if I have some scissors and I nicely cut, it's going to be a nice clean cut, right? Now, if I'm going to take this paper tape, and make sure y'all hang on to the end of this video because I'm going to show you how you can work some areas out if you're having discomfort. If that baby comes through in crowns and it just rips, you see the difference? The ripping is different, right? So some doctors will go in and go ahead and give that cut to allow a clean cut. Now, when they finish, they're going to have to stitch you up. So think about it as layers of the chicken. You have the skin, you have the connective tissue, that gooey area, and then you have the meat, right? That meat's going into the pelvic floor. Well, they cut the skin of the chicken, which is the skin of our Virginia right here, the perineal area. After the baby, to allow more flexibility, the baby comes through, and then they'll end up stitching that area. Now, that stitching requires healing. So some women, and I didn't have it, but if you either had a perineal tear or you've had a episiotomy, kudos to you. You are a champion as well, because that takes healing. You're sitting on that area, so it's very uncomfortable. So think about it. If you have a piece of a chicken or you cut your hand somewhere, what happens? You'll see that scar, right? And sometimes the scar tissue will actually kind of thicken up a little bit before over time it smooths out. It's the same thing that goes on in the perineal area. So as the skin is sealing itself back together, it's some thickness, there's some scar tissue. So what happens is that area in between becomes very thick and it's uncomfortable. So you may notice in your question, you may ask me, it's like, well, Tamara, well, yes, I've had an episiotomy or I've had a tear during childbirth. should I be having pain? So that's the first thing to know, that with pelvic therapy or anytime there's a problem with you, your body's sending pain signals is a sign something is not right. Something is not doing what it needs to do. So that is very common. So if you've had a perineal tear or if you've had an episiotomy and you have some thickness or tightness there, and you're having discomfort specifically during the time of intercourse or inserting a tampon, realize that area may need to have it needs to be loosened some. So here is an expansion of the vaginal canal. How y'all like my tape roll? All right, so this is the vaginal opening, just like we're talking about right here, right? Here's the perineal area. So if this is the vaginal opening here, and this right here is the perineal area, this area right here is it could be thick, depending on if you're somebody that scars up a lot. This area is uncomfortable. So just to give you a tip, if you are having those issues, again, I've told you in previous lives, you should be assessing your Virginia at all times. Once a month, just check on her. How's her coloration? How does she look? How's she feeling? Is she having any odor or anything like that? But look at that area. Take the mirror, look down at that area, and you can just take your finger. So if I'm laying on my back and this is my finger, and you need to probably be more at an incline area so you can see yourself with the mirror. And once you've washed your hands or you want to use gloves, take your finger and insert it. And I'm gonna go at an angle. Insert your finger into the vaginal canal here, and then grip it a little bit here. Does it feel like it's tight, right? Is it tight there? Or if you scoot to one side. So if this is here and this is 6 o'clock and I'm laying back, this right now is to my left, this is going to be about 5 o'clock, and to my right, this is going to be about 7 o'clock. So with me putting pressure here, is that uncomfortable? Is it uncomfortable here? Is it uncomfortable here? Then drop down. So this is the bottom of the canal, the opening. This is the anal area right here. In this area, is that uncomfortable? And that's where the episiotomy is going to be. The beginning here to going towards the canal. And the thing is, it'd be better to get a clean cut than a rip, because if you rip, sometimes that rip can really rip and go. Some women truly rip from the top to the bottom. So from the opening of the vaginal canal all the way to the anal canal. So on top of giving childbirth, they are dealing with this severe pain that is down here, and it is very, very, very uncomfortable based on what has been exhibited in the office and based on what my friends have said too. So what you want to do is take your time and working on loosening that area up. So stick your finger into the base of the canal, and you may say, "Ooh, this is very uncomfortable." And it's almost like a rubber band. You know how a rubber band is really, really stretchy? Well, when you stretch it out, if you stretch it, think about it, it's going to burn. So when you're working on stretching it out, you may have a burning sensation or a tingling sensation when you're doing it. And then when it eases off, it feels better, but it may still have a residual burning sensation. It's just like the first time you've had intercourse. You know, it's very uncomfortable. You have a lingering burning sensation. It's the same thing. Things needs to be stretched out. So we call this the ring of fire. So what you're going to do is you're going to take your finger and you're going to put it right here at the base of the vaginal canal. And I just want you to take your finger and kind of sweep. And you say, "Well, Tamara, how far do I go in?" Well, you want to go in at least almost to about a knuckles depth. Now, if you say, "Hey, I really can't even put my finger in that deep," then don't start off that low, that deep. You may have to just insert the tip. You just have to give it some attention to working on stretching that area. So if you're inserting just here, kind of coming at an angle, and I'm at the 6 o'clock, but I'm having it at an angle here, you're gonna push down and kind of just sweep a little bit to one side and come back. Sweep to one side. So when you're doing it, you're putting a little pressure down, because if I take something and put pressure, that's going to be a natural stretch, right? If this is the opening, I put pressure, that's an extra elongation of the tissue. And then when I do a sweeping mechanism, that's a stretch. Be very gentle, because if this is something that has been going on for a short amount of time, it's going to be very, very sensitive. If it's something that's been, say you've been having this discomfort for 10 years, it may not be as uncomfortable, and you could be able to give a little bit more pressure, but definitely push down and sweep, right? Because the hole is a circle, right? Hopefully your hole is a circle. Ain't no diamond, right? It should be a circle. So sweep to this side, come back in, sweep to one side. So don't do it both at the same time. That may be too much. If you have discomfort and is not severely bad, and you are able to engage into sexual intercourse, then you can put both fingers in there and push down and kind of sweep both at the same time. Now, I would start with one finger. If you're really sensitive, push down, sweep here, then push down, use the other finger and sweep the other way. And over time, as you're able to tolerate it, you'll be able to sweep both. And that will definitely work on stretching this area to have a bullseye. That will definitely allow the opening so you can be able to tolerate some form of insertion, whatever your pleasure is. It would allow the decreased discomfort with it. Now, again, coming here over that spot where the scar, say you had a tear or the episiotomy was performed there, taking your finger and just kind of rubbing it over there. Now, say if you are having some dryness, I would suggest you getting some type of lubrication and just taking your finger over the scar and just kind of rubbing in circles up and down the scar. Be careful, don't go too far near the anal canal, which is down here, because that carries a lot of bacteria, and we don't want that coming towards the vaginal opening, because that can increase your risk of having a urinary tract infection. So start here and just kind of work your area there over the scar at the top, then go to the side of the scar. Put a little pressure in there. Do what you can tolerate. If you can tolerate bigger pressure, give yourself bigger pressure. If you can't, it's okay. Circle in those areas. Same thing on the outer side, on the opposite side. Now, I would start here and then work your way down, because then once you go down, you're going away from the vaginal canal. You're going to decrease the risk of bringing bacteria from fecal waste to come near the opening. So if I'm starting here, working here, come down a tad. Remember, this is not a big area. It's a very small area. So I'm working here, and work your way down. You say, well, how long should I do that for? Do what you can tolerate. I wouldn't sit there and be there. I wouldn't be doing it for 30 minutes. But I would say maybe a good 2 or 3 minutes. Do what you can tolerate. So work a little bit on the outer part, or just inserting in the opening at the beginning where the incision is, and then work your way down. And it's having a episiotomy is very common, and some women heal perfectly fine and don't have any issues. When I am looking at my women, and if they, whatever their comfort level is, if they allow me to do a pelvic floor assessment, then that's the stuff that I'm looking at. It's like, okay, you come into the office and you're having pain. Well, why are you having pain? And they may not be able to put their finger. They could just say, yeah, I've just always kind of had pain down there. And I can see either the tear or the incision where it was from the scarring. And a lot of times that is the area that gives them some discomfort. So hopefully this has helped you if you have had this before, or if you have known someone to have it. Definitely let them know these are normal things that come along with having these problems or these procedures or these occurrences, but there's ways that you can relieve this discomfort. And just realize there's different levels when it comes to the skin. So it's not like you tear the outer skin or the outer skin is cut. They cut through all 3 of those layers to be able to get to the opening. So again, that childbirth is not an easy process. There's a lot that comes along with that. And this is something that can cause issues when you have during sexual intercourse. Definitely a time for it. If you have any questions, definitely drop them in. If you don't want to ask questions, I understand, because this is a very, very sensitive conversation. But again, you don't have to live in this discomfort. There is things to help you. And it's just like you stretching your body, right? If I have tight hamstrings, which are at the back of my legs, or if I have a tight bicep muscle, like at the beginning, it's going to be very, very uncomfortable. But as you do it a little bit more, you'll start noticing it's a little bit better. And it may be something, even if your pain is so uncomfortable that after you've been able to stretch, you have a bigger opening and you're wanting to engage in sexual intercourse, you may need to work on extending that area, because then over time it tightens up. And if you're not having sexual intercourse, it's going to be very uncomfortable. So you may have to transition yourself. And that's what I do with women. It's like, okay, once we are able to at least penetrate a finger or two, or you do it and I'm showing you, I'll help you, and then I show you, you may need to work yourself up, because you may be dealing with a partner that may be a smaller size versus a partner that's a bigger size, or just inserting a tampon that is uncomfortable. So depending on what you're trying to accomplish, bigger sizes or bigger openings that you're trying to accomplish for whatever reason you're trying to do it, you may just want to be able to tolerate going to your OBGYN appointment and not spazzing out and go through anxiety because they are inserting their tools in there, right? Because it's uncomfortable. So then we do progress to using dilators that will eventually, they have different widths, and then we can progress your opening. And there's many women that come in and say, hey, I want to be able to have sex. I want to be able to do that. But their opening, for whatever their reason is it because they've had an episiotomy, or they've had a perineal tear, or they may have been in a situation where anxiety plays a lot. Again, I've told you in the past, stress, as women, we hold our stress down in our Virginias. And that stress, if you've been maybe sexually assaulted, it's just like you've closed up, because your body is just restricting you anything. So that transition, you may need a gradual graduation into different levels when it comes to the opening of your vaginal opening. And it could be even just, you may not have had intercourse in a very long time, or you may not have even had children, and that area hasn't been opened up in a while. So those are different reasons as to why you could also have discomfort. But not to come off the topic of episiotomies, because that's what I'm talking about, but I'm also sharing with you as well, even though if it is or is not an episiotomy and you're having discomfort because of a narrowing of the canal, the vaginal canal, or because of the episiotomy or not because of the episiotomy, there is still the same mindset, how I treat you. I still treat you. The goal is you want to be able to have something inserted in your vaginal canal, from a tampon to a penis, or to some type of toy, or whatever your desires are. The ultimate goal is to allow an outcome, either pleasure or getting a job done, a tampon, or having a assessment done by your OBGYN, gynecologist, or whatnot. You need to open that canal. And if you're having opening canal because of restriction, because of skin matter, of an episiotomy, or because other things have occurred, we got to work on stretching. So that is the stretching technique that you can do. The ring of fire, right? As I showed you, one finger or the other, and as you progress, working on both at the same time. And then also at the base of the vaginal canal, working on doing those, doing the perineal scar tissue massages to be able to loosen up that area, picking this area up and pushing it down, wiggling it from left to right. That'll definitely stretch it out. And over time, you'll definitely notice a increased flexibility of that skin area. And some too, it brings on stimulation, increased blood flow, because some, after having these procedures, there is nerve endings are affected, so you don't have the sensation that you may have had prior to this situation of an episiotomy or a perineal tear. So hopefully, if you did not know what an episiotomy is, now you know what an episiotomy is. If you did not know what a perineal tear is, now you know it's better to have an episiotomy than a perineal tear. And now you know how you're able to increase flexibility increase your flexibility to be able to be involved with any type of insertion, from a tampon to a toy to a penis, whatever you want to put up in there. You know how to open that area so you won't have discomfort. And you know that therapy can help you with that. If you were to go to a doctor or an OBGYN, they're not going to talk with you about that. They're not going to tell you how you can do it. They may give you some type of medication or say it may work over time on its own. But if you want to get to faster results, you have to take action into doing those. And pelvic physical therapy is a specialty that works specifically in areas of decreasing pain, increasing flexibility to any and everything that's below the skirt and affecting your pelvis. So hopefully you enjoyed it. If you have any questions, drop it in. I know I'm a couple seconds ahead of y'all. I will give you a couple seconds to return to put something in if you do. How did you like? I thank y'all for tuning in or dropping your comments in last week. I was having a little fun time. I started thinking about what people in my life, if it was my mother or if it was my grandmother or auntie, what did they call my Virginia? Or not my Virginia, their Virginia. And mine was pocketbook, envelope, private part. And it was funny to see y'all's different names that when I first started my daughter, she was like 2. I called her Nunu, but I started realizing she really needs to know her area. So when she turned 3, because she could fully talk, she was walking around like a vagina, and that's what it was. So it was cute to see some of y'all's responses. I will definitely continue to do little fun things, because I want us to be able to take these private matters and feel comfortable to talk about it publicly. I'm not saying we need to walk around town and use a megaphone, I think that's what it's called, and just be yelling out vagina. We're not trying to do that, or vulva. We're not trying to do that. But it's okay to talk about it, because it's a part. We talk about our boobs, we talk about our butt. I mean, it's just another part that's covered, but it's a part each and every one of us have. We need to embrace, because she does so much, and we need to care for her because we need her. We definitely need her. So thank you guys for tuning in. If you have not got your ebook, please, and I'm gonna type it in here if I know how to, definitely get your ebook if you have not. It's for any and every woman to allow you to live out loud below your skirt. It's 5 tips that you need. And make sure you don't just read to the bottom. Make sure you read the whole thing to get to the end, because it's for every woman what you need to do to live your best life below the skirt. So I hope you ladies have a great evening. Thank you for tuning in, as you always do, very consistent. And I will consistently be here to continue to bring you information about private matters, making it a public conversation. So I hope you ladies have a good evening, and I look forward to seeing you next week, Tuesday at 8, same time, same place.